The global media have played a significant role in keeping the public informed since the COVID-19 outbreak, almost, 2 years now? The ongoing pandemic has led to unprecedented coverage the world over, and in some instances, journalists themselves have been infected with the coronavirus. This morning, we explore the coverage of COVID-19 from a journalist's perspective. Let's bring in SABC International News Editor Sophie Mokoena. She joins us now. Sophie, very good morning to you. I was listening to Israeli Prime Minister yesterday, Naftali Bennett, saying that this new variant has a potential to be very dangerous. And he said that they are raising a red flag and they understand that they are on the verge of a state of emergency. Which other countries, Sophie, have or are thinking about imposing travel restrictions over the Omicron variant?
Well, many countries have done that yesterday and a day before. You know that the UK did impose a red list on South Africa and other SADC countries. And of course, many countries did follow. The country like the United States of America did the same. And you have countries in Asia who have done the same. And of course, some in Europe, including the recommendation from the European Union that countries in the European Union bloc must do the same. And therefore, it is happening. It is almost like a wildfire now. And South Africa is trying to put down fires. And not only South Africa, but countries in the SADC region. And now this whole thing is taking a shape of almost like discrimination against certain regions, particularly the Sub-Sahara. You know that the Sub-Sahara region always has challenges. And it is unfortunate that, again, much as countries were not able to assist the Sub-Sahara to access vaccines, and we are still struggling, you have this situation now where we are being discriminated against and almost being locked in a cage. Almost like monkeys. Again, African monkeys now locked in a cage. They can't go anywhere because they will infect the so-called developed nations. They did the same with HIV and AIDS, even though HIV and AIDS was detected in one of the developed countries. The same with this COVID-19 or coronavirus. It was detected in China and, of course, Europe and America. We are the last continent to have had this problem. But here we are carrying the burden of the stigma as a continent.
You heard the health minister describing some of these decisions as emotional. The Israeli prime minister also went on to say that they have been working with other world leaders and now is the time to act. It's time to act fast, it's time to act early, it's time to act hard, it's time to act strong. But all of these things, as you know, Sophie, has economic consequences. What sort of conversations are being had around the world regarding the mitigation measures for acting fast and early?
We have to move from the premises that no one is safe until all of us are safe. And therefore, whether the developed nations or your G7, including your G20, with their friends, take certain decisions, all of us, we are going to be affected. And excluding Africa, it's not going to help them in any way. We saw what happened. Like I pointed out, that it started in Asia, Europe, America, us. And we were the last continent to have this problem. But we are now supposed to justify our approach to this whole thing and how we are dealing with this thing, as if we are the creators of the problem. Even this new variant, we know that there are reports now that emanate from research that was done by the developed countries and organizations that deals with the economy around the globe, that it was detected in July. And you have Botswana saying that they received 4 diplomats who came to their country and they detected this before South Africa was able to detect this variant. And therefore, one can ask a question, those 4 diplomats, it's a pity, it is a pity, because our ministers, when they were having that media briefing, they didn't give full details to say, we detected this variant. It is a South African who had traveled abroad, or is it a national issue or internal infection, or it was an imported case? You know that when we started with COVID-19, it started in KZN with people who had traveled to Europe, Italy in particular. And therefore, it was an imported case from day one. Even in this case, this variant, yes, it was detected in South Africa. South Africa being transparent and a democratic country that doesn't like to hide issues or hide challenges. Our scientists did a sterling job to detect this, but go public to warn the world so that the whole world can come up with solutions. But now we must take a blame for us being proactive. It's something that the World Health Organization has spoken about and was very harsh on the United Kingdom for taking these measures and other countries. Because what South Africa did, what our scientists did, was to say, wake up, there's a problem. How do we work together? Instead of these countries working with us, what did they do? They decided to lock us out. But they don't even have that kind of expertise that we have. We might be a continent that is forgotten, or perhaps where the developed nations don't really care about us, but we have developed expertise that they have failed to demonstrate. You know, they even failed to demonstrate the origin and the challenges of COVID when it started. And now we've made advancements to ensure that it doesn't caught us off guard as the globe. Here we are now being stigmatized. And I think the leaders on the continent must take a firm stand against what has happened to us, South Africa.
Let's talk more.
Being transparent and trying to help the world.
I think that's the point. That's an important point that you raise. Omicron, the official line is that it's a variant that was first identified in South Africa, but it must be stated that it does not mean that it originated here. And as you say, many have praised the work done by our local scientists in identifying these new variants. Some have called it excellent science. But how can we make world leaders better understand this and better inform their decision?
Well, Botswana, Kamakwe, who are these four diplomats? Which country do they originate from? What were their movements? Because you, Botswana, you detected this before South Africa. Why did you keep quiet? South Africa, you have details in terms of the patient. Please be frank. Are these South Africans? These South Africans, if these are South Africans, did they travel abroad? Let's get finer details. Let us expose the double agenda by developed nations, because we don't know where this thing originated from. Yes, it was detected on the continent. Congratulations to the scientists in South Africa for a sterling job. Don't get tired. Continue to do the good job. And the leaders in the region, particularly in the SADC region, why? Where's the statement from SADC to defend those countries that are affected? What is SADC saying? Malawi, why are you sleeping? You are the chair of SADC. What are you doing to defend the region? Why do we have the regional body when the regional body is not doing anything? Why South Africa must bear the brunt now, and those other countries that are being stigmatized? Then move to the continent. Where are you, Africa? Who is the chair of the African Union? DRC, what are you doing to defend your member countries in the southern region that are facing this backlash? Let's move to the United Nations. The UN must speak. You cannot continue with discrimination and stigmatization of countries that are trying to ensure that we live in a better world.
Let's break it down with regards to the issues of stigma and discrimination. And as you know, Sophie, we've been discussing this. So much has happened over the last 2 years. On the 31st of December, I flew back to South Africa from Italy. My family spent Christmas there. And at the time, we were just learning about this disease called COVID-19. And as we know, Italy was hit really hard in the early stages. It was in the news daily. And I remember thinking, you know, I went on this once-in-a-lifetime holiday, but I was so reluctant to talk about it because of the stigma that was attached to that country back then. 2 years down the line, Sophie, from your reporting and from the reports that you've received from our correspondents from around the world, has the issue of stigma and discrimination gotten better or worse?
It has gone worse. Even when you talk about economic challenges. You have the G7 meeting, making commitments, delivery, dololo. You have the G20 meeting, making commitments, some of them, nothing has come forward. Yes, the United States of America must get credit where credit is due. President Biden was able to deliver whatever he promised. But where are the other countries? I mean, even the COVID facility that was established by the World Health Organization in partnership with Gavi and other countries, and South Africa being a co-chair of that facility, there were commitments made during the fundraising, but nothing has happened. Even today, some countries are still struggling to access vaccines. And therefore, I think I don't know, what are we going to do about this? And that's what the Secretary General of the United Nations, Antonio Guterres, was talking about, that we have regressed as the globe. We have regressed. The issue of stigma, discrimination, and the developed only taking care of the developed nations, it is continuing. I mean, we have been condemned to poverty, diseases, and struggle, but we are part of the global village. And these countries, they came to the continent, they plundered our resources, they are glitz and glamour today because of our gold, our diamond, our platinum, cobalt in the DRC right now with technology, but they leave the continent poor and suffering and with diseases. And this must come to an end. But however, our leaders also must be aware. Africa, wake up. We are on our own.
Look, I heard someone say in a pandemic, individual liberties end where collective responsibility begins. Do you agree? I guess, science works best when you look at the evidence, bring all the different opinions together, and then make a decision. We shall see how this plays out. As always, Sophie Mokoena, our SABC international editor, we thank you very much indeed for your perspective. Be well.